Hi, my name is Dr. Lance Terry with Texas Healthcare, and this is another episode of Ask the Doctor. And the question that was presented to us today is, what's the difference between an X-ray, a CAT scan, and an MRI? And so I'd like to go through those three things with you and help you understand the difference, but I'm also going to kind of explain why we use those special tests here at Texas Healthcare when we're dealing with our patients. One of the very first and most important things is that we diagnose the patient correctly. And a part of that is making sure we take very good x-rays. Each of us in our clinics here, we have our own x-ray machines so that we can have that study done on the first day that the patient comes in. Sometimes a patient will come in and they've been to the hospital and they've had certain x-rays taken. Some of those x-rays are great when you're looking for fractures and those type of things. Some of them aren't as helpful because then the hospital will have the patient laying down. It's important that we get weight-bearing x-rays where a patient is standing up and we can see the posture, because there are misalignments and things that can shift and move when the patient is standing. So let's go over, this is an x-ray of a patient's lumbar spine. And the reason why it's important is you can see the vertebra, you can see the position of the spine itself, you can see the spacing where the discs are, and you can see the shape of the vertebra. And all of those things are very important in how we treat the patient and how maybe an injury might have happened. When the hospital takes this picture, sometimes the patient is laying down and you won't see the same curves, you won't see the same position. And it's helpful to me as a chiropractor to be able to see the different positions that a patient has naturally to see if those things need to be corrected. So when you're looking at an x-ray, we're obviously looking for fractures, we're looking for different pathologies and things, and then we're also looking for posture and position. When we need to get a more detailed test like a CAT scan is in a sense the same as an x-ray, but it's also done in what they call a three-dimensional view, which I can show you here. So on a CAT scan, you can still see the vertebra shape and you can see the space where the disc is, but you can also see this different view where it's as if the vertebra themselves are laying on end and they actually make a slice or a virtual slice so you can see, and it is the very best way to find little tiny fractures that you might not be able to see on an x-ray. And it can also show a number of other things around the vertebra and some inflammation, and so it's a very, very valuable test, which is an x-ray or a CAT scan is the primary thing that a hospital will use on an injury initially. Now, as we treat a patient, it's necessary to see all of the injury, and sometimes you can hurt things more than just the bone. The tendons, ligaments, other soft tissues can get injured, and you cannot see that on an x-ray or a CAT scan. The very next most important type of treatment or scan that needs to be done is an MRI. That's done with magnets. It's not radiation. It's a little bit different, but it will tell you any inflammation that's in there. It will tell you any tiny little small little tears in the tendon or disc. And it then also points out, and I don't know if you can see it here, but when you're looking at the side view of the lumbar spine, you can see where a disc is herniated back and pinching the nerves or compressing the spinal cord. And then you have small discs to large discs, and those are best visualized with an MRI. And so when you have those type of tests done, then it helps you completely diagnose the patient so that you can know exactly what type of an injury they have and what type of treatment needs to be done. So an x-ray obviously is the very first thing we would do to see if there's fractures and look at posture. A CAT scan might be utilized to make sure there's no little tiny fractures that you didn't see on an x-ray. But then to truly find out exactly what happened to the joint or the disc or the ligaments, then an MRI is needed. And so us here at Texas Healthcare, we utilize all three of these to make sure that we diagnose and treat our patients properly. Thank you so much again for watching another episode of Ask the Doctor. I hope this was very informative and educational, and so that you would know a little bit more about how Texas Healthcare takes great care of their patients.